Hi, and welcome to a very special webinar today, hosted by American Society of the University of Haifa. On this webinar, we'll be discussing varying global perspectives and responses to COVID-19 with a specific focus on China. I'm joined here today by Dr. Manfred Green, Director of the University of Haifa's International Master's Program in Public Health and Global Health Leadership, and also by Xue-Jing, University of Haifa alumna and graduate of Dr. Green's Public Health Program. Jing is currently working at the Joint Technical Institute in China, a joint campus between University of Haifa and East China Normal University, and joins us today live from Shanghai. Dr. Green, Jing, welcome, and thank you both for joining us.
Thank you very much, James.
Hi.
How are you, Jing?
Great.
So Dr. Green, I'd like to kick this off by first speaking about this amazing international MA program that you run at University of Haifa. What sets it apart from other public health programs, and how has bringing together students from across the globe been a unique advantage in this field, especially over the past year?
Thank you, James. Basically, maybe 7 or 8 years or more, I teamed up with Professor Richard Schuster from the University of Georgia in Athens, Georgia in the United States, to look at the possibility of having a summer program, bringing students from abroad, particularly from the University of Georgia, to experience Israel and also to experience some of our program. We have a very large Master of Public Health program in the School of Public Health, but it's all taught in Hebrew. So I apologize for the noise, by the way, they're working in the background. I hope it'll stop soon. So let me just mention, so the idea really was to open our program to be more international. And then we started to look at the possibility of actually starting an international Master of Public Health program in English. And we developed this program with a very strong emphasis on leadership, which we thought was lacking in other programs, and global health. And we were very pleased to have Jing in our first cohort coming from China. So maybe I can hand over to Jing to say a few words.
Well, absolutely. Jing, as a graduate of University of Haifa's public health program, we wanted to know what you learned during your time at the school and what served you today in your career from that program.
Okay, thanks. I have to say that master training in the MPH program is kind of a very important milestone for my career path. And we have very well-designed curriculums and very professional professors who always help us. And also I have a group of very lovely classmates, and we share our experience, and we deal with our homework together almost every day. So I learned a lot from my classmates who came from different countries. So it's very interesting program, I have to say it. And also it's a very international setting. And in the program, I just gradually built a sense of international vision. And I start to think about what happens in other countries and how people deal with different public health issues in other regions. So which provide me more profound ideas for the research and for critical thinking. So I would get all this credit to the program. Thanks.
Amazing.
Right, I'll just add one sentence and say that the interaction between the students being international and coming, and now we've already had students from about 20 countries or more on just virtually every continent. It really does strengthen the program and makes it a very, very different experience.
And I'm guessing the past year as well has made that global aspect of public health even the more important.
Sure, this year we have 20 students, and in fact we started with 21, but one of the students actually has actually taken a break for a while, but will be coming back. And again, it's been very challenging because of COVID, like everywhere else. We've managed, though, to keep contact. And one of the interesting features is that despite the fact that we are teaching online at the moment, we're teaching using Zoom and so on. The students have been meeting together, and we've had occasional social meetings, maintaining social distancing. We've met in the park opposite the university, and so we've maintained this kind of friendly atmosphere. But it's the students have really got together and made this a really very worthwhile program.
That's great. That's great. So a question for you both here. You've actually both been working together, conducting research on different mask policies being administered around the globe. Can you tell us anything about the study and even your preliminary findings, perhaps, thus far?
Well, I'll introduce and then I'll let Jing continue. One of the issues with masks, and this is not something new, but unfortunately we were unprepared, was that the messages for the use of masks to actually prevent spread were very problematic, very unclear. And in the beginning, as you remember, it wasn't clear whether they should be used at all. And then they said we could use them and only in certain circumstances, and then not use surgical masks, only use homemade masks and so on. So there were not, it was very, very confusing. And I think we need to learn a lesson from that. And again, I think Jing will mention what their experience is China. So what I'm doing with Jing at the moment, we are doing a study together to look at how masks were used over the period of the pandemic in different countries and what were the messages. So maybe Jing, Jing has already put together a huge compendium of about 200 countries already. So maybe Jing, you could mention what you've been doing.
Yeah, thank you. So according to the very early findings we have like for this status, we found that like an average of 70 days that the country have to like, how can I say, it's 70 days the country will publish their first mask policy after the first case confirmed in their country. So, but we can also see the differences between different regions. For example, the African region, it's like they averagely took like 50 days between these periods. So, but for the Euro country, they took longer to publish their first policy. So we will look into more detail about these differences and the outcomes or the effectiveness of this policy, and also the change of these policies.
I want to just make a comment on that. People, say, well, why is it so important to study masks? The Institute for Human Health Metrics, I think in the United States at Washington University, have estimated that there have literally been hundreds of thousands of deaths that they believe could have been prevented if we'd effectively used masking much earlier and more. And I think we need to learn from China, because China actually did that. And China has been very successful in containing the pandemic.
Yeah, but one point is have to mention is like apart from using mask, the government also like applied other measures to deal with the pandemic. So it's kind of like hard to distinguish which part of which part of like effectiveness could be contribute to the mask, and which part of them should be go for other measures. So it's like they combine together. So it's hard to distinguish them.
Very good point.
Yeah.
Right, and I'm sure we'll learn more as this study comes to fruition. Now, in 2018, University of Haifa and China's ECNU unveiled a joint campus in Shanghai called the Joint Technological Institute, as we mentioned earlier. The 4,500 square meter campus focuses on areas of study, including biomedicine, brain science, and environmental science. Now, we're obviously lucky enough to have Jing currently based at the campus. So Jing, what more can you tell us about this joint campus and the journey that's brought you there?
Yeah, of course. So the full name of the institute actually is called Joint Translational Science and Technology Research Institute, which jointly cooperated and run by two universities. One is a very top university in China called ECNU, China, East China Normal University, and another one is the University of Haifa. So it's located in China, Shanghai, and its goal is to cultivate students, both for master students and also for dual degree PhD students in the area of applied science and technology. So my story with this institute is like when I graduate from the MPH programs, and I know the existence of this institute, and also I know there is a policy position vacancy in the institute. So I just want to like break the link with University of Haifa. So I decided to apply for this position. So that's why I'm here. Thank you.
Excellent.
By the way, Jing was one of our most outstanding students. So,
Really outstanding. Thank
outstanding,
you.
really outstanding.
That's great. That's
Thank
great.
you.
We're honored to have her here on this webinar. So Dr. Green, back in Israel, the country continues to stride towards normality. Yet worldwide, coronavirus cases have topped 152 million, while deaths have surged to more than 3 million, with obviously deepening crisis in places such as Brazil, India, and France. How important is the need for a global collaborative effort to reduce these numbers? And what can actually be done to put such a system into effect?
Well, there's no doubt that a global effort is going to be much more successful than each country trying to make their own decisions. One of the things that I think we need to look at is to now look at the variation in the results that different countries have achieved. And there's no doubt that the vaccine has been pretty much the major player. But it's not just the vaccine. I think it's also behavior and the way in which they've operated lockdowns and socialized, social distancing and so on. I think we need to be very creative. And I would suggest that there should be, well, there is already a collaboration through the World Health Organization, but I think we'll be more and more creative as to the way in which we'll be using the vaccines. For example, following to a large extent the UK example of giving one dose to more people than giving 2 doses to a smaller group is probably the guiding light for many countries now to control the pandemic. So at the individual level, there'll be less protection, but it seems that it will be a lot more effective in preventing spread. So it's going to be a common, but we need to learn from one another. And the last thing I'll mention, we need to share data much more effectively. And it's improved, but we're still far from it. And the WHO has started a very important project with Germany now. I've forgotten the exact name. I think it's something like, it's a data center basically, and a data analysis center, but it's a very large undertaking. I think that's an incredible step forward, because if we know what's going on, we pretty much have made a huge step towards actually controlling the actual pandemic.
Right. So, Jing, I want to focus a bit more on China now. So as of, I believe today, China has administered around 275 million doses of the COVID-19 vaccine, which is actually just over 20% of the population. Can you explain why the vaccination rate is so low?
Yeah, so when we see the number, it's pretty high. I know it's quite ranked very high. Single dose rank very high in the global environment. So it's but when we focused on the total populations who had complete 2 doses of vaccination, so I have to say the rate is quite low. Even between 4% to 5%, because I remember 1 month earlier, the rate is about 4%. So, but when we focused on the medical workers, according to the news, we have more than 80% of medical workers who had been fully vaccinated. So I have to say the first big reasons for this low rate for vaccination is because we have a very large populations. So we still have very long journey to vaccinate as many as possible in order to get the herd immunity. So, and also for a lot of people, when they finish their first shot, they have wait in a long line to get in order to get their second shot. So therefore, we also face like a lot of areas here face the shortage of vaccinations. And so at the same time, and people kind of doubt their susceptibility and severity of the virus. So they think the risk of disease is quite low because when we look around the big environments, China is a quite safe place here. So we don't have local cases for quite a long time. So recently we only have like new cases who's come from overseas. So when these people can go into China, they will do their 2 weeks quarantine. And if they test positive, they will send directly for the treatment in the hospital. So there is a barriers between the general people and the new cases. So people believe that we have very safe environment. This lower their motivations to take the vaccine. And also they also concern about the safeties and effectiveness of the vaccine, because according to the news, we know that probably the effectiveness of the vaccine is 6 months. So we live in a safe circumstance, and if the effectiveness of the vaccine it's like only this half year, so which means they have to do that again after half year. So they will probably postpone their vaccination plans.
Interesting. Yeah. And I want to pick up on something you said there. You talked about the low vaccination rates, but you also talked about China's COVID cases being extremely low. Now, Dr. Green, while other places in the world continue to struggle, how do you explain this phenomenon in China, where there are both low vaccination rates and also low COVID cases?
I think it basically can be summed up by the word discipline. And that's a discipline at all levels, at the national level and the local level and the individual level. And we've seen that in Taiwan, and we've seen that in New Zealand and Australia to some extent. So the countries that are able to basically, to a large extent, seal their borders and maintain very strict border controls are obviously in a better position to prevent cases coming in, especially if they're screening everyone who's coming in and doing it effectively. And the social distancing and masks and so on within the country, wherever there's a possibility of cases, is strictly enforced. And Taiwan is an example where they've actually succeeded in that effect. But I know that they are really concerned about getting their population vaccinated. They also have a very low vaccination rate at the moment because they haven't managed to access vaccines at the rate that they need. So that means that they will be at risk of actual outbreaks if they don't keep very strict regulation. And I think Jing will tell us that in China, even now, the regulations are still very strict. If there are cases that, I think Jing will tell us, right? Maybe you would comment what happens if cases are detected, what is done?
Yeah.
Jing, what happens when you detect a case? I mean, that area is basically sealed off. It's really...
Yeah, of course. if there is a new cases from the local local areas, people who, where people live in, so they will seize the related areas to get everybody the testing, and also for the cases like epidemiological like tracing, and so, and this testing will be twice or 3 times. So, and also they will keep this place closed for about several weeks to make sure that they had found like every positive cases.
And that's interesting. I'd love to expand on that perhaps a little bit more as well. How would you describe life in China today? Are things relatively back to normal given these low cases? And I guess, looking forward, what is the country actually doing with regards to international travel? Is that something that is being talked about as a potential thing that might happen soon?
Yeah, thank you. So I have to say that you can see our life is gradually go to like regular settings, but you can see the difference because now the government is adopting regular prevention and control measures. So uh, we just finished our 5-day holiday. So during this period, we have more than 200 million people traveled inside China. It's a very quite frequent traveling situations. So maybe you can see the pictures from the news. A lot of people, a lot of places are very crowded, and some people wear their mask and do their like preventive measures, but other of them may don't do anything to protect themselves. So uh, we it, but some places are still closed. For example, if you want to go into the university or some buildings, you have to do the reservations to go inside. Um, so the government is focusing on the vaccination programs. I have to say it's but for the international travel, the Department of Migration doesn't encourage international travel on the purpose of like just tourism. But you do need to do the international, for example, business travel, or for the purpose of professional issues. Then the government had issued the international travel health certificate. It's kind of like a Chinese vaccination passport. So if you log in the app, there are informations about testing and informations about vaccinations. And also the government is working with other countries to make this process and to have collaborations on the international travel.
I think also
that's interesting. Yeah.
Jing has also told me about the electronic tracing. I mean, you have right, everybody has pretty much a code, right? A barcode where they check into places and check out, so they can follow people very easily.
Yeah, correct. So the government had built a very strong database. So you can log in the app, and the app will show the places you have been, and also the testing. And also they recently include the informations of vaccination. So if you get vaccinated, some samples of the app will become different colors. So because in order to get into some places, for example, like stations, you have to show this app to show that you are safe enough to go into. Yeah.
That's fascinating. Right. That's really fascinating. I know we've talked about this in the past, Dr. Green. That kind of global one system that
Right.
could be potentially put in place. Free range of travel overseas. I mean, we've talked about various reasons of why that might be difficult to implement, but something like that sounds like it would do a long way, in securing safety. But at the same time, I imagine that might be hard to implement in other countries around the world. Now, on that topic of different policies around the world, Dr. Green, I did just want to, before we finish here, and Jing, please feel free to chime in as well. What are some of the best takeaways, and I guess we can talk about misses too, that you've seen from around the world in this battle against the pandemic?
Well, I'll start with the problems and then end on a much more optimistic note. But the issues obviously were, as I said, poor messaging, very poor public messages, which were confusing. We mentioned masks and so forth. I think they were too dogmatic, and that's why they kept changing. I don't think that the people, the governments or public health authorities gave messages that showed there's sufficiently the uncertainty in the messages. And then when the messages changed, this basically created a certain, not only confusion, but I think you may even say some anger. And I think that some of the messages also, as I said, wearing masks outdoors was still something that was not very clear to people why that was so important, particularly if you were in sports event. So there were issues like that. I think that we didn't really have a good plan for the schools. And I think that has to be taken in. And we have to actually not just have messages, but we actually have to prepare the schools that they are actually built in such a way that you can have much more social distancing and keep children in subgroups and so on and so forth. And I think that can be done. Ventilation. There are a lot of things that can be done that should have been done anyway. And now I hope that will happen. I think the optimistic part is that the world has shown how quickly vaccinations can actually be developed. I mean, obviously, this is only for one virus and it may not be applicable to others. And we can't really say, well, tomorrow we're going to have a vaccine against HIV or hepatitis C. But certainly, I think we've made very large strides, very big strides in vaccine development. And I think that that's going to serve us for other vaccines. So in that sense, and again, the last thing again is that we've learned how to very effectively communicating using media like Zoom and so on and still keep functioning. So there are obviously things that are going to stay with us. And hopefully the hygiene part will also stay with us. We don't have to use alcohol or alcohol all the time, but just, wash your hands when appropriate and keep places clean. That's a good message anyway. It's reduced other diseases, by the way. So that's going to be a good message.
Right. Excellent. Well, I'm afraid that's all we have time for today. I want to thank our two amazing guests today, Dr. Green and Jing, for widening our perspectives on the global nature of this pandemic. If you liked what you heard today, please also join us on May 20th, 2 weeks from now, where we'll be back with Dr. Green and also joined by Dr. Dorit Nitsan, Regional Emergencies Director of Europe at the World Health Organization, and Dr. Andrew Morris, a Professor of Medicine at the University of Toronto, for part 2 of our Global Health Perspective. If you do have any questions for any of our guests, please email us at info@asuh.org. And to support the University of Haifa's vitally important public health program, please visit asuh.org/donate. From all of us at ASUH, thank you and please stay safe.
Thanks very much. Thanks, Jing, and thank you, James, obviously.